Good morning everybody. I am Dr Adhishwar Sharma. I am a plastic surgeon with a microvascular training. I have done my MBBS from MKCG Berhampur, Odisha in 1992. We recently celebrated 25 years of entering MBBS course, and followed by, after finishing my MBBS in 1997, I went in 98. I joined PGI Chandigarh, where I did my training in general surgery. And after finishing my general surgery training and passing MS general surgery, I worked for another 3 years in PGI as a registrar, followed by 3 years in Civil Hospital Karnal, and then I joined general surgery, plastic surgery training in Safdarjung Hospital, New Delhi, which is one of the most premier, largest department of plastic surgery in India. After finishing my general in 2010, I joined 2007 and I finished in 2010. From 2011 and 12, I spent doing fellowships in hand surgery and head and neck surgery, in which I learned about the microvascular surgery, hand surgery, about treatment of brachial plexus, which is my passion and my key interest in treating patients of brachial plexus and peripheral nerve surgery. And then I spent another 6 months in head and neck in Amrita, learning head and neck surgeries, how to do head and neck reconstructions and various head and neck tumor management and other things. And in 2012 January, I entered practice, and briefly about then I was working in Central Hospital Faridabad for 2 years. Then nowadays I am mainly working in Fortis Gurgaon, and a little bit of my work is there in Metro Hospital Faridabad, and plus I run my own clinic in Brahmanand Clinic in Faridabad, which is located in near BK Chowk NIT. And I want to talk about my key passion, that is brachial plexus injuries. My brachial plexus is basically nothing but plexus of nerves which comes from the cervical cord, and it supplies from downward from shoulder to hand. It controls every movement of your hand. So hand is a very critical and the key component of human body. It's the key gainer, means you are not gainfully employed. Your potential as a human being is not fulfilled if you don't have a functional upper limb and functional upper limb, including hands. So regarding brachial, and these injuries are nowadays increasing because they are of mainly two types. One is pediatric injuries, other is adult. Pediatric is mainly birth canal injuries. Children's their plexus is damaged during birth, and these are basically low and other is the adult injuries. Adult injuries are mainly high velocity injuries suffered by the teenagers or young adults during while driving motorcycles or having fall from height. And there are few injuries which caused by tumors and iatrogenic dissection during surgery and other things. So main bulk, 90% are causes from the roadside traffic accidents. And you see, though brachial plexus injuries doesn't kill the person, but it effectively puts a person out of his employment and his social life. He is handicapped for life unless that arm functions are restored, and that person cannot achieve his economic potential as well as his potential as a human being. So treating these injuries and having these injuries is not only you rehabilitate a human being, but you also make society more productive. So we have got a lot of experience of treating these injuries in my clinic and Fortis Gurgaon, and this thing I have done more than 200 cases of these injuries. And I have been writing a blog about, as a plastic surgeon, as a doctor, as a human being. We touch so many human beings in my lifetime and in my practice. So I have been writing all those interesting stories in my blog, Brahmanand Clinic at Blogspot and Brahmanand Clinic at WordPress. There are two blogs, and there is another third blog, Herbs and Brachial Plexus Injuries .blogspot.com. So in these, if you visit these blogs, you will see how, as a plastic surgeon, as a doctor, we touch the people's life and we make them more productive and we contribute to the society. Thank you very much.